Hi, Kevin Sarb here to tell you risk rule revisions that will be implemented as part of the release on May 18th, 2016. The risk revisions that are occurring occurred as part of a routine cyclical review process that USDA conducts, and it will be implemented, as I said, with the May 2016 release. May 18th, 2016 release. Those, the affected risk codes are 201, low hematocrit or low hemoglobin, 211, elevated blood levels, 332, short interpregnancy interval, formerly known as closely spaced pregnancy, 361, depression, 381, oral health conditions, formerly known as dental problems. 411, inappropriate nutrition practices for infants. 425, inappropriate nutrition practices for children. 601, breastfeeding mother of infant at nutritional risk. And 602, breastfeeding complications or potential complications. So for 201, low hematocrit, low hemoglobin, the priority level for non-breastfeeding women was corrected to reflect the appropriate priority levels. As part of the risk help documents, Table 201C was created and included, having been previously omitted. No other revisions were made to this risk. And as I want to let you know now, as I review all these risk revisions, the changes that will occur in the WIC system, and either will change screens that you will select from, or be automatic system changes that will assign the risk based on the information you put in. So none of the manually assigned risks will change at this time. For 211, elevated blood levels, the definition has been revised to reflect the current reference value published in guidance from the CDC. This risk is generated when blood levels are greater than or equal to 5 micrograms per deciliter for all categories. Previously, greater than 10 micrograms per deciliters generated this risk. Although this risk revision is timely, USDA updated this risk independently of current events based on CDC guidance, and the risk help documents will reflect this change. Risk 332, short interpregnancy interval, which was formerly called closely spaced pregnancies. The definition cutoff has been revised to reflect a more recent review of data indicating increased risks for adverse perinatal and maternal outcomes with the interpregnancy interval of less than 18 months or 540 days. The previous cutoff was 16 months or 480 days. For 361, depression, this risk has been removed and should no longer be assigned to the children category. Guidance for screening and referring women with or at risk for depression. The guidance was developed to accompany risk 361 depression to clarify WIC's role and to increase WIC staff awareness and knowledge in assisting participants diagnosed with or at risk for depression. All sections of the risk help have been revised and updated. This new guidance has been added. So in order to prevent you from assigning the depression risk to the child category, if you'll notice the screenshot, that's no longer an option when you do the other medical conditions for, or the current and diagnosed medical conditions for a child category. This is a very simple one. Risk 381 is now called oral health conditions. It was formerly dental problems. And as simple as that, when you look this up in the as a risk, then it will say oral health conditions and not dental problems. Okay, for 411, inappropriate nutrition practices for infants. Only section 411.9, inappropriate sanitation in the preparation, handling, and storage of express human milk or formula, that is the only section of the risk write-up which is revised and updated. Of note, a threshold for the amount of time human milk can be safely stored in the refrigerator has been deleted as a risk criterion. There is lack of consensus among professional entities, for example, the American Academy of Pediatrics and the American Academy and the Academy of Breastfeeding Medicine, about the length of time human milk can safely be stored in the refrigerator. Thus, it's not possible at this time to set a clear cutoff to determine WIC nutrition risk. Also, please see the justification section of this criterion for more information in the help docs. My WIC nutrition history screen has been revised for breastfed infants. If the mother expresses breast milk, ask her how she stores the milk. Provide guidance if there is any food safety concern. In section 425, inappropriate nutrition practice for children, only section 425.01, routinely feeding inappropriate beverages as the primary milk source, is revised to be consistent with the March 2014 WIC regulations final rule. Revisions in the WIC food packages, which allows the option to issue reduced fat milk or 2% milk to children 12 to 23 months for whom overweight or obesity is a concern, or the medical provider has recommended reduced fat milk, or they have a family history of obesity, dyslipidemia, or cardiovascular disease. The risk help docs in the MyWIC screens have been revised, as are shown on this screen. I also want to share with you that we have revised the wording for inadequately fortified milk substitutes. There have been instances where CPAs incorrectly check this box for children assigned a soy milk package, which then assigns this risk. So as you're aware, WIC authorized soy milks are fortified to the same levels as cow's milk. The 601 breastfeeding mother of infant at nutritional risk, simply pregnant women were added as an allowable category for assignment of this risk because, as we well know, that breastfeeding women do become pregnant and are being assessed in certification sessions. And similarly, risk 602, breastfeeding complications or potential complications. Again, pregnant women have been added as an allowable category for assignment of this risk. We hope that this will not impact you greatly as you, after the release. It's a very simple behind-the-scenes revisions to the risk assignments. And if you have any questions, feel free to send them in or to contact me at any time. Thank you.
Good morning, everyone. My name is Rick Schneider, and I'll be finishing the presentation on Release 7.5. I would like to thank you all for joining me today. I am the WIC System Management Specialist under the guidance of Dr. Cooper Egtedary at the State WIC Office. Today's presentation, we're going to cover some different pieces of the Release 7.5 that are really going to be of interest to you all at the clinics and your staff, as well as some new functionality that we're introducing to help people use the other browsers besides Internet Explorer. We're going to touch again on the multi-document printing functionality as well as some things to watch for at the conference and just reviewing some upcoming dates. One piece that we wanted to bring back to everybody's attention is that right now Microsoft is only supporting Internet Explorer 11. What this means is that the Internet Explorer 8, 9, and 10 still may work with MyWiC, but they're not receiving regular updates, security updates, if there's any functionality or bugs that come up in those earlier browsers, they're not being supported by Microsoft anymore. This could lead to experiencing more issues with MyWiC as those browsers get older and they fall farther and farther behind without those really critical updates that have to come from Microsoft. So at this time, we're encouraging everybody that if you haven't already converted to Internet Explorer 11, we really want everybody to do that, and we're putting out a date of May 6th for that to happen. Now, this may be something you'd be able to do at your local agency without your local IT, but if you have a centralized system, you'll probably want to get in touch with your local IT office and have them start working on it, but it should be a very seamless process for everyone. So again, this is only if you already haven't converted to Internet Explorer 11. We want to make you aware of that. And in the upcoming releases after this release, it will be really important that you do for some of the functionality that we're bringing in. Kevin just gave a nice explanation of some of the risk code changes that are required by USDA. So I won't rehash those here. I just wanted to reemphasize that if you have any questions or concerns beyond today's presentations, please feel free to follow up with Kevin or your WIC consultant, and we'll be happy to try to answer those questions for you. Now, some new functionality that we're excited to be able to bring to you all. One of the roadblocks that we've had with allowing people to use other browsers besides Internet Explorer is that currently in MyWiC, the scanning and the signature pad functionality don't work for anything other than Internet Explorer. So if you were trying to certify a client, eventually you would get stuck at this point if you were using Firefox, Safari, or Chrome. With this release, we're going to be introducing a new software that will allow users to use any browser, including Internet Explorer, to scan with. Now, the instructions to upload the software will be provided on June 1st. The important thing to note as well is that for people that are currently using Internet Explorer, after the release there will be no change. The system will know whether you're using Internet Explorer or if you're using Safari or Chrome or Firefox, and it'll be able to route people to the correct screens based on the browser that you have. As I said, this will require a new plugin to be installed on each workstation that would be using an alternate browser. And again, that may be something that your local IT would have to assist with. And we're actually looking to transition everyone to this new functionality by August 5th. So this will give us about a good 3 months or so, 2 to 3 months for people to get this new functionality uploaded. So it'll be a great feature for everyone. It will help streamline, and again, it helps us use all of the same browsers. Now, after the release, again, for people using Internet Explorer, there's no change. You'll still be able to use Internet Explorer without loading up the new software and the plugin. You'll be able to go to the same menu option under Miscellaneous. You'd select Scan, and you'd be presented with the same screen, just as you were before the release. The functionality will all work the same, and it will really be a no change if you continue to use Internet Explorer. For the folks who would like to use a different browser, such as Safari, now the system will actually route you to a new scanning page. Functionality will still be the same. You'll still select the same document types. You'll still select the same user the same client, but the scan function will be on a new page. It will look new, and you'll again need to have that plugin installed before you could actually use this functionality. On the miscellaneous dropdown in the clinic module, we have a scan-new link. So two above the one that's highlighted is the regular scan that you currently see with Internet Explorer, and the scan-new will actually take you to this new page. And with this new page, again, you'll be presented with a pop-up, and then they'll ask you to download the software plug-in onto each individual computer if you wanted to use, again, one of the non-IE browsers. It's a very quick process to download, but again, it may require local IT services to assist with this, so you'll want to plan accordingly. Once you do have it downloaded, you'd be able to, again, enter in the document type, the client ID, just as you do right now, scan the image, save it, and all of the other features will work just as it does right now in MyWIC. For signature functionality, it's a similar process as what we have with scan. Again, one of the barriers we've had for people to be able to use the non-IE browsers is that you couldn't use the scan functionality did not work without this new software. So again, new software will be provided to people through MyWIC after the release. It may require your local IT again to come and load that software onto each individual computer. Instructions along with the scan functionality will also be provided on June 1st. And again, this new software will work for any internet browser, including Internet Explorer. And as with the scan functionality, we're going to provide a transition period for people to upload the software, and then by August 5th, we're aiming to have everyone have the software loaded on the computers so that we can help streamline and easier maintain the different functionalities in MyWIC. As with the scan functionality, post-release, if you continue to use Internet Explorer, there will be no change. You'll still be presented with the regular menu selection option for signature. If you move from the additional family information screen, the system will know whether you're using Internet Explorer or Safari or Chrome or Firefox. So the system will know which page to route you to. If you're using Internet Explorer, you'll be presented with the same screen with the same functionality as you always have been previously. If you're using a non-Internet Explorer version, again, the system will route you to the correct signature capture screen, but you still have to have that software loaded onto your computer ahead of time so that the screen will work. Otherwise, you'll get an error message. Again, as with the scan functionality, we have a new signature-new menu option underneath the miscellaneous tab, and this will take you directly to the new signature capture screen. Here you can tell the difference because even though the screens look very similar, up in the upper right hand corner you can see that there's a signature pad driver, a signature pad configuration links. That's where your local IT staff would actually click on those links to upload the plugins to make this work for you. So we don't have the ActiveX controls anymore that we'd be using for the non-IE browsers and eventually Internet Explorer. Again, all of these changes though are going to be transitioned into over time. We want to give everybody adequate time to both work with your local IT to upload this information, upload these plugins, so that we can really support MyWIC and our users as efficiently as possible. The direct print document functionality. I know this was one where we had tried to put it in the release 7.0. We had some issues with our servers. We were able to find out what those issues were, and we were able to correct those. That correction will be implemented in the upcoming release. Right now, I just wanted to cover again what the direct print document functionality will do and what the different features of that will be. So right now, you have to select each individual document by selecting a checkbox, which opens up a single PDF page, and you have to print that document, close it, and then go to the next one. And we've heard from many users that it's a quite tedious process. What this will do is allow you to select as many of the documents as you'd like, or you could do a select all and print all of those documents in one PDF window. So we'll still bring up a new PDF window. You would you'd print from the Adobe PDF window, and then it will print all of those documents for you in succession. One thing I want to note and point out is that the print versus the preview functionality is still going to be maintained. So if you select preview documents, it will bring up the window, the PDF window that will be full of all of the different PDF documents, but it will not write a message that those documents were printed into the communications screen. If you select the print functionality, then it will, on the WIC screen, it will bring up that PDF window with all of the documents, and it will write the message to the communication screen. So that's the difference between the two. If you want that communications record to be found in the communication screen, or if you just want to preview it, give the client the document and send them on their way. Again, that's the difference between those two buttons. So we'll look at the screen again. The screen is not changing. The layout will all still be the same. Again, in the upper left-hand corner, you can see the Select All box. If you chose to select that box, it will select all of the different buttons that are available for that client. If the checkbox is grayed out, it means that the client didn't meet the requirements or the criteria for that document to be applicable, so it won't be printed for that client or the family. Again, I just covered the differences between the print selected and the preview selected. I just really want to emphasize the difference between the two and the information being written to the communication screen, just so that users are aware of the difference and can select the correct button based on whatever your needs are for that client and family. You'll still get this nice message at the bottom saying that the printing is completed. And again, you'll be presented with a series of all the different reports, and they'll all just blend together. It'll just run from one page to the next, to the next, to the next of the different reports. They'll all still be in order. They'll all be listed together, but they won't be in separate PDF document windows. So you'll only have to print hit the print button, one time for these Adobe PDFs to actually be printed, rather than going to each page individually. I should note though, you still have that option. If you did only want to print, say, the shopping list, you'd only select the shopping list from the print document screen, hit the print or the preview selected documents, and then you could print the document as you do right now. And this is just a picture of the communication screen indicating which documents have been printed, when it was printed, and then who the staff member was that actually printed those documents out. And I know this is an item that comes up in MEs, so again, you'll want to work with your staff to make sure they're selecting either the preview or the print based on the requirements at the time. Another item we're working on is a new enhanced mapping functionality and feature. Right now in MyWIC or in WIC Client Connect, the mapping functionality is not working. but we have a new functionality that'll be more accurate, provide better responsive results for our clients and for clinic staff. We're really excited and we're working with DTMB on those different features to actually implement those maps based on the state maps. So we'll know that it's the most accurate information that we have available. Right now, if you go to the client vendor listing report that's on the print document screen, as well as the client vendor listing map that we'll show in a second. Both of these maps have a feature where you can toggle to show different distances. These distances are based on a straight line distance from the client's home address. So when you print this report, it'll say provide all of the authorized vendors within a 10-mile radius from the client's house. Okay, so that's an important distinction to make when we're looking at the different vendors available. If we were to run this report, we'd get this nice grid printout. It provides some of the pertinent information on authorized vendors from the client's house, and their phone number, the contact information for the vendor. Our hope is that clients would be able to call the vendor, see what stock, if they're looking for something in particular, is available. May have an easier time finding products, especially for some of the specialty items, rather than having to guess and go to different locations. For the client vendor listing map, this will actually provide a physical map to the clients. So when we would print on this item would come up and it will show a physical map. It'll have a centralized pin, a buffer at a 1-mile radius, and a buffer at a 5-mile radius out, showing where the vendors are physically located. It doesn't show the driving route and things of that nature, but again, it will help give a pictorial form image of what the client, what stores are around the client, which ones are closest, and again, it will help them try to find a location for them. This same functionality will also be implemented into WIC Client Connect, and in WIC Client Connect, we're actually basing this off of the physical street address that the client has provided within the WIC Client Connect application. So the slight difference is that in WIC Client Connect, the default will be to their physical home address, and that information would fill in the screen. The client can then remove that information if they would like to, put in an address, say, of if they're staying with a family member for the time, or if they are traveling on the weekend. They could put in any physical address and have the map come back with the different vendor locations. And again, it will be authorized vendors that the client would be presented with. For this, they would click the map button, and the map button would present back a series of vendors that are within the area. We really hope that clients are able to use these and staff are able to use these to help give, again, the idea of where vendors are located, and having that process be more interactive. It's just another tool to help make it easier for the clients and the staff. As I provided some updates in our last webcast that we had done maybe a week or two ago, we are also making some modifications to the single certifier monitoring report. We're modifying the existing report requirements. They'll be implemented in the release, and those requirements are going to be based on policy 9.03. I've spent, as well as Three Sigma, a lot of time with some of our NPE consultants, going through the policy, making sure we have a clear understanding of the requirements and a good way to implement these. We don't want to share exactly what all of those screens are going to be, because it would be a security risk, but be rest assured, based on the information we have and the interpretations we've gotten on policy, the the current process will change, and it will be more in line with existing policy. So we're really excited to get this back out to the field. In addition with this, we have more bug fixes that we're putting into MyWIC. Certain ones such as the lab screen, different functionalities that we've heard and we've been able to test and reproduce, we're then able to fix. Once we have them fixed, us at the state as well as our pals will go through, test them mercilessly, make sure everything's still functioning as it should be, and have it implemented in time for the release. And this is really a big push for us in this release. We want to make sure MyWIC is operating to the level and expectation that everyone has. So we're really excited to get these bug fixes in and get a good, continue providing good services to everyone. Now, some things that we want to I want to remind everybody about as we move towards conference. We are going to have a DSM table at conference in the presentation room or the vendor auditorium there. And there's two major demos that we're going to be provided. One is going to be an opportunity for people to demo the WIC Client Connect mobile application that we've been developing with 3 Sigma. This mobile application would do is give clients the ability to view information on their phone about their account. So it'll be things such as how their remaining food balance. It'll be things such as where certain vendors are located and phone numbers based on their GPS location on their phone, as well as some other really neat features that we're really excited to show everybody and receive feedback on. We want your feedback to know what features are most interesting, what changes could be made. You know, we're looking to get some good responses, and we know we'll receive that from you and all of your staff. So we're really excited for that. The other feature the other component that we're going to be demoing at the WIC conference is the My Login functionality. As I had said in the last webcast, the My Login is a statewide replacement for SSO, and this is going to be implemented at the end of July. What it means for all of you is that you will have to go through what's called a multi-factor authentication. It is a relatively quick process, and all of your information will be converted over from SSO to My Login. But we want to give everybody a chance to see what this multi-factor authentication looks like, what does it feel like, so that you and your staff are ready for it when we do implement. Again, that's going to be in late July of this year. The other thing that we're looking for, and this is my own shameless plug, is we're starting up some work groups. We're going to have 2 work groups that we're starting up, and we're looking for volunteers. The first work group is a system work group. It'll be to get a better touch from the locals and better feedback and buy-in from locals on the different things within MyWIC that you would like to see, different components that are there that you'd like to either see changed, enhanced, what's useful, what's not useful. We want to have a better mechanism to get feedback rather than just sporadic feedback that we receive now. We really think the best way to do that will be through a work group. The other piece that we're looking to start up as well is the emergency backup system work group. Again, this will be a work group that will really focus just on the emergency backup system. What does it need to be? What does it need to do? Which of our locals will be there to help us test for it and get this implemented and running. Once it's running, then it will be a matter of seeing what features need to be enhanced, which features could perhaps drop off. All of the different components that we'd want to get in a work group. We think, again, the best way to get that feedback is from some dedicated users who really know the ins and outs, and we'll be looking for some volunteers at conference. So some dates and times to remember for this release. We're requesting that everybody stop using MyWiC by 5 o'clock on May 18th. That'll be the night of the release. The reason we need that extra time is because we have, we have our resources that are going to be testing that night once the build goes into production, which takes time. And we're going to be testing, and we want to make sure that we leave enough time to test it adequately and well, without staying until 4 or 5 in the morning and possibly just having people be too tired to test and test the way that it really deserves to be tested. And the only way we can do that is if we start and leave enough time to do so. So again, we're asking everybody to stop using MyWiC by 5 o'clock. When you come in the morning on the 19th, Release 7.5 will be available to all of you, and we're really looking forward to this release. We've got some great components that we've got included that we think will be some nice enhancements and some nice fixes to MyWiC that'll really help help everybody use the system better and keep us moving forward. So at this time, we'll take a little break and ask some questions. Feel free to send those in, and we look forward to hearing from you. Everyone, I would like to thank you all for the couple of questions that we had gotten, and thank you guys for coming back. One of the questions that we had here was just a clarification question, that if you're still using Internet Explorer after the release, there will be no new plugins or changes that would need to be made. That is correct. During the transition period after this release and before the beginning of August, you'll be able to continue using Internet Explorer just as you always had. Once we get closer to that August date, and as we're moving through the transition period, you'll want to make sure that you've upgraded to Internet Explorer 11 by that time, and you will have to install those new plugins again during transition, so after the release, so that you can continue using MyWiC once we turn off the current functionality. The software that we're implementing will eventually replace both the scan and the signature parts that we currently use, but after the release, you're correct. There will be no change, no plugins needed if you continue to use Internet Explorer. Second question, or a couple other questions here, came in about some specific bugs. Those specifics on bugs, I don't want to get into right here, but because we'll be providing that in the release notes, and we'll have some more information there. But I just want everybody to know that one of the big pushes that we have in this release is to clean up and fix any bugs that we can reproduce, create a fix for, test it, and implement. Those are our key steps. Providing we can do all of those, we will fix the bug. If we can't, we'll work to get more information, or we'll keep working until we can get a solution in place. So rather than talk about specific bugs, just keep an eye open for the release notes when those come out before the release, and we'll have more information there. There were also a couple of, there was a question or two about the risk codes and specifics on risk codes. Unfortunately, I'm not the correct person to answer those questions. I'd encourage you to contact Kevin Sarb or your WIC consultant, and they'd be able to assist you further as far as the details on some of the risk code changes that Kevin had presented earlier in his presentation. At this time, though, I'd like to thank you all very much for your time and attention. I hope you all have a wonderful day, and thank you again for your continued support of MyWiC and all that you do for our WIC clients. Have a wonderful day.